and the medical science saving lives. Deep inside your brain, a complex network of rivers carries oxygen and nutrients, sustaining every thought, movement, and memory you possess. Blood is constantly pumped from your heart up to the brain, delivering life-sustaining energy through these intricate and delicate vascular highways. At the base of the brain lies a vital junction called the Circle of Willis, where major arteries connect and circulate. This circular arrangement ensures blood is distributed evenly, but the constant pressure at these branching points can eventually cause serious problems. Sometimes due to genetics, injury, or disease, a specific section of the artery wall becomes significantly weaker than the surrounding tissue. As blood pounds against this thinned area, it forces the wall to balloon outward, creating what we call a cerebral aneurysm. These berry-like sacs often form at bifurcation points, where the blood flow splits, creating the highest amount of hemodynamic stress. Some aneurysms remain small and stable for a lifetime, but others grow larger, becoming ticking time bombs within the skull. As the aneurysm expands, the arterial wall becomes dangerously thin, losing the elastic layers that normally keep the vessel strong. The real danger arises when the structural integrity fails completely, leading to a catastrophic event known as a hemorrhagic stroke. When the wall finally gives way, high-pressure blood erupts into the subarachnoid space, the area between the brain and skull. This bleeding is toxic to brain cells, causing immediate irritation and increasing pressure inside the skull to life-threatening levels. The spilled blood irritates normal vessels, causing them to constrict, which further reduces oxygen delivery to critical areas of the brain. This combination of bleeding, increased pressure, and vessel narrowing leads to severe swelling and potential permanent damage to brain tissue. The most common symptom of a rupture is a sudden, excruciating headache, often described by patients as the worst of their lives. Victims may also experience blurred or double vision,
Are you all right?
extreme sensitivity to light, nausea, and a stiff neck alongside the pain.
I need some medical assistance over here, please.
Confusion, seizure, or loss of consciousness can follow quickly, making immediate emergency medical attention absolutely critical for the patient's survival. However, unruptured aneurysms often remain silent, causing no symptoms at all until they grow large enough to compress nearby nerves. Warning signs of a large, unruptured aneurysm can include pain above and behind one eye, a dilated pupil, or drooping eyelid.
At the CT scan here.
Numbness or weakness on one side of the face is another potential indicator that a growing aneurysm is pressing on nerves. Doctors diagnose these conditions using advanced imaging techniques like MRI or CT scans to visualize the brain's blood vessel structure. Once an aneurysm is detected, the medical team must decide between monitoring the situation or intervening with a surgical procedure.
Hand me the elevator, please.
If the risk of rupture is high, doctors will recommend treatment. One common method is a procedure called surgical clipping.
Exposed.
In this procedure, the neurosurgeon performs a craniotomy, removing a small part of the skull to access the aneurysm directly. Using a microscope, the surgeon carefully navigates through the folds of the brain to locate the neck of the aneurysm. A small metal clip is placed across the neck of the aneurysm, instantly stopping blood from entering the weakened sac. This effectively isolates the aneurysm from circulation, preventing it from rupturing and allowing the vessel wall to heal over time. For patients who require a less invasive approach, doctors may opt for a procedure known as endovascular coiling. A catheter is inserted into an artery in the groin and guided up through the body's blood vessels into the brain. Using real-time X-ray imaging, the surgeon navigates the catheter precisely to the site of the aneurysm inside the skull. Once in position, Soft platinum coils are pushed through the catheter
coils fill up
and
the
released
aneurysm
directly
sac,
into the hollow space
creating
of the
a tangled
aneurysm.
mesh that blocks
These
blood
coils fill the
circulation
sac,
within the weakened
causing the
bulge.
blood inside to clot and sealing off the aneurysm from the main artery. Over time, the body forms a seal over the opening, effectively excluding the aneurysm from blood flow without opening the skull. Both methods are effective, and the choice depends on the size, location, and shape of the aneurysm and
Your
patient health.
recovery is
Recovery times vary,
well.
but
The
early
scans look
detection and
clear.
treatment
So when can I expect
significantly
to be
improve the
discharged?
chances of a full
Okay,
recovery
push it
and a
all the
normal
way
life.
out.
Good.
Rehabilitation
Good, now
may
hold
be
it right
necessary for some
That's as
patients to
far as it
regain
goes.
strength
That's
and
excellent
function,
progress. Keep
especially
breathing.
if a rupture had occurred before treatment. Most patients return to their daily activities, proving that modern medicine can effectively manage this dangerous condition when caught in time. Managing risk factors like high blood pressure and smoking is essential to prevent the formation or rupture of cerebral aneurysms. We have witnessed the life cycle of an aneurysm, from its silent formation to the advanced medical interventions that treat it. Understanding these mechanisms empowers us to recognize warning signs and seek the necessary medical help before it becomes a crisis. Your health is your most valuable asset, so listen to your body and never ignore sudden or severe neurological symptoms. If you found this video helpful, please share it to spread awareness about this critical medical condition to others. Don't forget to like and subscribe to our channel for more educational content explaining the wonders of human anatomy. Thank you for watching Body